How's everyone doing today? Good. Woo-woo! Right? Yep. How many of us are used to sitting for an entire day of just absorbing information all day long, right? It's so hard, and this is only I guess it's day 2, because we had all day yesterday. I missed that, unfortunately. Welcome to everybody on live stream as well. I am super excited to be a part of this portion of the conference while we're here in Houston. We're going to talk about cats. Yay. I love talking about cats. They're so much fun. Specifically, we're going to be talking about teenage cats. And we're going to look at a couple of details as we go through this block. My goal is to leave enough time for questions, but I also want to get to some of the good kind of meat at the end, the second half, where we're really trying to get some of the strategies. And what I hope to be able to impart as we go through this is not only some of the kind of the nuts and bolts things, but also, again, how we do what we do, where in many cases it's so much more than just the recommendation we give, but how are we creating that resonance with the client? How are we trying to create or foster that empathy and sort of align ourselves with them in this treatment process? So hopefully we'll find some strategies along the way for places to pull those in as we cover a fair amount of information over an hour and a half or so. I want to touch base on just a kind of a smattering of things. This isn't necessarily all going to be in this order, but I hope to be able to touch on all of these individual components over the course of our time together this afternoon. I want to touch on the owner's perspective on teenage cats as best we understand that. Some of the details that surrounds the way I think about it in terms of the reason why this information is so important for us as behavior consultants or veterinarians or even pet owners to know and understand. We're going to talk about some physiology things, some developmental periods, and then really getting into more of the nuts and bolts and how do we really start to tease out what it is that's going on, how do we best support not only the animal, but the human that goes along with that animal, and what does that process look like for all of us. So let me ask you guys this. How many of you have or have had an adolescent cat in your home? What are some of the words that come to mind for you, or perhaps your clients, when you were asking to describe, especially when we're thinking maybe about some of the difficulties that go along with adolescence? Are there any words that come to mind? Crazy? Terror? Bossy, obnoxious? You know, what I'm missing is loving, sweet, calm, sedentary. Yeah. So you kind of get the idea, right? So when we're talking with clients, I think a lot of these issues, kind of the theme, tends to highlight the difficulties, right? And I think, even though we often, for those of us who do work with both cats and dogs, or any other species for that matter, I think there are times where we emphasize this preemptively. At least I try to do that with my canine patients, but sometimes I think we miss that a little bit for the cats. And so we're kind of leaving the owners to come up with their own emotional impressions of what that experience looks like, right? So some of the ones that are up here: spiteful, aggressive, too playful or too active, aloof or independent, the wild child, coming back to the crazy mindset here, naughty, so that we not sort of like a value judgment on their behavior, they know better, right? Have we ever heard that one? Or maybe even said it ourselves? And then sometimes they get more specific. It's what I get. I should have known better. Right? It's kind of my fault. It's sort of the undertone behind that one. But he was such a good kitten. I kind of read into that almost a sense of longing. Like, oh, he was such a nice kitten. I'd really just like him back. Right? So we've got some of this, and in some ways that can actually manifest in almost a form of grief that sort of gets an undertone to how the owners are viewing that relationship or that part of their life. Maybe there's the impression that cats can't be trained. So, we're stuck, right? I didn't expect this. Or maybe they're trying something in the way of more of a punishment, sort of the easy punishment, grabbing the squirt bottle, things like that. It's not working. So now there's these sort of, I'm helpless, I'm frustrated, what I'm doing, what I know how to do isn't working. The emotional subtext of a lot of this, I think, is relevant when we're actively trying to support our clients through this process. And, we could take a statement like this, client may say, oh, they can't be trained. And we could jump onto our high horse and say, well, if Ken Ramirez can train elephants, right, without even interacting without a relationship, I'm certain we can do this with cats, right? Or we could acknowledge that, yeah, I know that maybe it seems that way, but if I were able to share some options with you, are you open to that? Can we create that inroad for changing mindset around some of these preconceived notions? Does that give us an inroad that might not have been available to us right from the get-go? So this is where we're starting from. Now, I am a huge advocate, whether we're talking cats or any other species, when we're working with owned animals where there is some sort of history or relationship, I'm a huge advocate for truly asking the clients, why do you think this is happening? What do you think's going on? What's your perspective on all of this? I want to know where they are, because until I know where they are, it's very difficult for me to give them the next steps of how to move them forward. But what I have to be really careful about as a behavior consultant or as a veterinary behaviorist is not allowing their perception to unduly bias my assessment of what's going on. So if they're describing that cat as naughty and I take that to heart and I'm thinking, well, gosh, if he really does know better, then how are we going to create values in this kitten, right? That's not the goal. We've got to come back to data and figure out what that's going to look like. Why is this important? I'm going to show just 2 quick stats slides here just to underline and really highlight the reason why this is so important. This was one particular study. Data is from the late 90s, so it may have changed a little bit, but this was one study that looked at surrender data, broken down by age. And in this particular case, roughly 46.5% of the cats that were surrendered to this shelter were between 5 months and 2 years old. So essentially half the population is coming in as an adolescent. For those of you who have been through adolescence, did you ever even for a fleeting moment think, I don't want to do this anymore? Right? I think it's a totally normal process, even just in a moment of frustration. And that's with a tremendous skill set. Without that, it's often a lot more overwhelming. So that was one study looking at that, about 46%. This one, slightly different age, slightly different population, but again, 5 months to up to 3 years in this case, looking at 40%. A little more even distribution across this one. But still, it is the predominant age of surrender. So what an opportunity. What an opportunity to be able to educate, to empathize, to really help clients through this if we are available for that. Now, in order to understand adolescence, I'm going to go back just a little bit and say, okay, this is part of the bigger picture of development. It's not the only stage that matters. So what's happening? And this will come into play when we start talking about some of the other strategies and other perspectives to keep in mind. So in these developmental stages, we start out with that neonatal period, birth to roughly 10 to 14 days. It obviously varies from one litter to the next, and if we're talking about individual breeds of cats, for example, the age can vary a little bit, but 10 to 14 days is roughly the end of this. A period of full dependence is kind of how we might describe this. They're really not able to function on their own. Senses are developing, but they're not developed, which means they're open to influence. The neurologic connections that are being created and or are maturing are influenceable at these stages. Now, there's a short transitional period that goes from roughly 10 to 14 days up to roughly 2 to 3 weeks or so, again, so very short, kind of a transition with some physical maturation characteristics. We start to see that nutritional weaning and perhaps some of the social weaning as well, and we move into that primary socialization period for cats. Now, for those of you who have done a lot of study on socialization, and we're going to talk for an hour and a half or so about what I'm referring to as the pitfalls of socialization tomorrow morning, one of the primary differences that I want to highlight here is that cats, compared to dogs, have a shorter and earlier socialization period. So if we are talking about sort of the average age at which a new owner may take that kitten into their home, unless they are bottle raised or fostered and are homed earlier, oftentimes that doesn't happen until at least 6 or 7 weeks, often 7, 8, or 9 weeks. And what we have to know is that for those kittens, primary socialization, as it relates to sort of that blankest of slates, I don't like calling it a blank slate because there's a whole lot of variation for the individual, but it's the blankest it's ever gonna be. That opportunity to layer in those experiences is essentially over in terms of that critical developmental period. We'll talk tomorrow morning as well about sort of the difference between experience expectant versus experience dependent developmental stages during that primary socialization period. And really what we're talking about there is sort of the Cliff Note version. Experience expectant is sort of the normal development that happens just by nature of that animal experience of the world around them. And every animal is essentially equally equipped that as long as they, for example, have things to look at, vision tends to develop along the normal pathways. That's different from experience-dependent neurologic development that is truly dependent on the quality as well as quantity of exposures that the animal has during primary socialization while those neurologic currents, if you will, are developing. So a little bit of a sidebar there, but this primary socialization period, lots of stuff is happening. And there was one study that showed there was roughly, they estimated about 15% of cats that were resistant to socialization with humans. I put that in here for a reason. I don't know that I necessarily agree to that statement, but what I think it highlights for me is that if we think about socialization as a one-size-fits-all approach, it's not going to work for everybody. That's the way that I look at this. So we may have individuals, just like we see in other species, that perhaps have a stronger behavioral or physiologic predisposition towards fear, anxiety, stress, or arousal that might need a higher degree of socialization in terms of quantity, but at a lower intensity level in terms of quality. If we just kind of take that one-size-fits-all approach, we're probably not going to serve that particular animal as well as we might otherwise do, and so they might fall into that 15% category. Now, during socialization, again, lots of stuff are happening, and all of this is preceding that adolescent or juvenile period that we're going to be talking most about this afternoon. And we do see some phases that peak during this time frame, but what I really want to make sure that we're not assuming is that just because we might talk about these developmental stages and say, yes, this peaks at 12 weeks or this peaks at 18 weeks, that doesn't mean that it's then over and done. Some of these patterns in terms of play behavior and object exploration and things that might actually get some of these kittens to adolescents in trouble are likely to persist for a period of time. So as we go into more of the juvenile period, this is now kind of the end of socialization up through early side of maturity. And we can describe this in a couple of different ways. We could talk about juvenile as it relates to these specific time points here, kind of the onset of sexual maturity, ending the juvenile period. Adolescence is often broader than that, where it's going to carry into that early side of social maturity. So for cats, we're likely talking maybe up to a year and a half, 2 years or so, if we're talking truly about the adolescent. But the honest answer is that when it comes to defining these particular developmental stages, or really saying this is the age of an adolescent cat, it's not really that well defined. It's just not. So a lot of this is sort of, take it with a grain of salt. We're looking more at a progression, and then we're going to look at some of the patterns of behavior that may be more prevalent during those times. I want to spend just a minute or so talking about, and actually when I say a minute, I really usually mean like 7 or 8 minutes, because I like doing deep dives on some of this stuff. It's kind of fun. This little graph on the right-hand side is something we could probably talk for the next hour about. As stupidly simple as it looks, it says so much when we start to tease it out. I'm going to give you sort of the semi-Cliff Note version of it. If you look at adolescence on the human side of development, we talk about things like risk-taking behavior and poor decision-making capacity in human teenagers. And again, that mindset of they know what they're supposed to do and they're making foolish decisions, for example. All of these different characteristics that go into human teenagers as well. This is one of the kind of working theories surrounding what's happening at the physical or physiologic level, is that we have two primary brain regions that are sort of playing off of one another. Now, in some theories, originally, if we were thinking about impulse control, for example, as a linear process that starts, at sort of the infant stage and goes through to adulthood, that this would be a learning linear progression as that prefrontal cortex, that executive function center of the brain develops, and as those skills develop, and this should be a relatively linear process. And yet, when you look at the behavior of adolescents across the vast majority of species, that's not exactly what happens. We don't necessarily see teenagers being more developed. In some cases, we see, infants, that primary socialization period where these puppies or kittens are learning tremendous skills, and then everything kind of goes sideways for a period of time. right? We see that in people, we see it in dogs, we see it in cats as well. And what's really represented there is the fact that different areas of the brain are maturing at different rates. So whereas we are sort of seeing a linear development of that prefrontal cortex as that portion of the brain is developing and the animal is learning developmental impulse control, what we also see during adolescence is an exaggerated rate of development within the limbic system. That's that part of the brain that's responsible for fight, flight, or emotional response patterns. I'm not going to go into too much detail in terms of the brain regions that we're talking about there, but several of them, are relevant. So what we see when we're looking at functional MRI studies, for example, in people, is that those brain regions associated with immediate gratification or reward-driven behaviors are actually more active during that period of adolescence relative to the period before or after. And that's really what this graph is attempting to illustrate, that even though we have a linear development of decision-making capacity, there is this exaggeration, and the relative gap that exists here is what is captured by that quote-unquote risky behavior. Now, this is where we go into the theoretical side of things from my world. My personal kind of view on this is not only with adolescence, but also just in an overall biologic predisposition. My gut feeling, again, I'm going to stress that over and over, this is my theory, not basing this with any sort of factoid. My theory is that many of the patients that end up in our care are those that have a wider gap between their ability to maintain appropriate logical thought patterns and those that are driven both during adolescence as well as perhaps other parts of their development by that immediate gratification piece. Whether we're talking specifically about dopamine or whether we're talking more about the fight-flight system and cortisol and epinephrine and norepinephrine and some of those other neurochemicals, I think that the disparity between those two developmental pathways creates not only risky behavior but risk. I think that's our susceptible population that is more likely to be affected by one-trial learning, that is more likely to be affected by negative experiences, where we could see conditioning taking into account some of those changes in behavior. So again, it's sort of a whirlwind look at a very complicated but still very simple idea. What I like about that is that it does start to explain a lot of what happens across adolescence when we dive into the multiple species. With that being said, this hasn't been particularly well studied in cats to say, exactly what age does this happen? Do we see those fMRI studies of an awake kitten? Can you even imagine? Right? Can you even imagine trying to do fMRI? Oh my God, crazy town. Maybe someday, but what would that even look like? So then let's turn our attention to more what the adolescent kitten looks like. So we start out with sort of an assumption that this is at least theoretically the same. Do we, and I'm asking you guys this as much as sort of going on my own experience, do you think that we do see a worsening of behavior as we see in other species? Do we have kittens that seemed like they were on the straight and narrow, and then things go a little wonky along the way? What do you think? Yes? I think so. I think we see it. I don't think it's the same as just having kitten behavior that now persists in an adult body. I think we do see changes. And so then we start to say, well, what does that look like? How do we describe it? What are we seeing? They all start out as angels, right? Complete angels. And then sometimes you wake up in the morning after a bender as a teenager, right? Sometimes you wake up with a lampshade around your head. And some days you're just trying to survive, right? All kinds of stuff happens during adolescence. These are 3 photos of Barry and Biden, the same kittens that we were seeing there, as they grew up, right? This is during teenage phase where everything gets called into question before they really come out the other side of social maturity. I love this. This was in a blog post, right? Get off the table. I'm going to read the text for those of you who are live streaming at home. This is from a blog post, so it's kind of like the owner's perspective. It's that kind of real, down-to-earth perspective. My cat is going through her quote-unquote teenager phase. It seemed like only yesterday she was so small and loving, and now all she does is run through the house clawing and climbing things. I'll get home and sit on the couch expecting her to cuddle. Instead, she jumps out of friggin' nowhere on me, claws me, takes off running. What the heck? When did this happen? I'm not looking forward to the teenage years, right? This is sort of the owner's perspective, kind of feeling blindsided, out of left field. Oh my gosh, what's going on? And so when we start diving into some of the actual complaints, if we start to figure out, okay, what's underneath that struggle, when we're talking about the frustration that the owners are experiencing, what are some of the actual behavior patterns that we can identify? And these are some of the ones that tend to be reported more frequently. Again, when we break it down from the emotional reaction down to the data, what specifically would you like to be different? I know you're frustrated now, but if we could wave the magic wand and make it better, what would that look like? What would you see less of? What would you see more of? What does success look like? Those are some of the things where we get to some of these pieces. So these are not, obviously, all of the different concerns that an owner might present for an adolescent cat, but there are certainly some of them. Now, before we start doing a deep dive on sort of how I approach some of those as well as other patterns, I want to look at some of the contributing factors just real briefly, just to kind of get an idea of where we're starting from with a lot of this. So contributing factors might be things like, I often refer to in the practice as casual management. And I think you guys probably know what I'm referring to here, but I'll describe it a little bit more. And I think this is more of an issue for cats than it is for dogs in many households. This is basically where we provide an environment for the animal to live in, but we're not really providing much in the way of proactive direction or guidance as to what our expectations might be for that animal. And what I really want to stress to my clients and my vet students and the individual people that I teach is that, guess what? If we are sort of sitting back on our heels, yes, we've provided a loving environment, but we're not providing much in the way of instruction, the animal's still learning something, right? But if we're not teaching, we're sort of giving up the opportunity to guide what they're learning. And that's something that I really like to sink in with my clients, is they get to decide. They get to decide to some degree what the outcome looks like. We get to define what success looks like, and then we can put a behavior change plan in place, or we can put those proactive recommendations in place to guide us there. But the opportunistic problems, the opportunity-based problems, can very much develop out of a lack of guidance. And again, I think some of this even goes back to that mindset of, oh, well, you can't train a cat, so we don't even bother trying. And yet when we start asking clients questions about some of the learned patterns of their cats, it becomes very clear that, in fact, they're learning all the time. But again, so I think this is much more of an issue within the cat population, more consistently there, and it's an opportunity for an inroad for us. In other cases, when we're talking about the adolescent behaviors that we saw on the previous slide, that might be because of insufficient exercise. Again, people who are going, out and getting a border collie puppy, I hope have the expectation that I'm going to have to get this dog out for exercise, right? We're going to go for walks. We're going to go, dog park if that's appropriate. We don't necessarily, the average pet owner doesn't necessarily go into kitten ownership thinking, I'm going to need to provide physical exercise. They're not aware of the vast number of times every single day that a free-ranging cat would engage in predatory behavior. Whether or not they catch or eat anything is sort of beside the point. They're not thinking about the motor patterns that animal would likely go through in a more natural environment, and certainly not looking at it from a regimented exercise standpoint. And yet, the absence of exercise exacerbates almost everything else. It's not a specific fix. We can't just say, oh, your cat's doing X, Y, and Z, exercise it more and you'll be fine. But the absence of exercise is likely to turn the dial up on everything else that's there. So I look at that as a factor. Lack of training, as I was mentioning, again, these are things where if the client is not even thinking that training is an option, they're certainly not going to be proactive about moving forward with it. And yet, I always find it fascinating how we might have a perception that they can't be trained, and then when we look at their patterns and we see what they've learned based on accidental or unintended reinforcement, whether that's through attention. And I find this, I teach at 3 different veterinary schools in the US right now, and I would say probably 40% of the students, I'm just kind of doing a rough ballpark on that, currently are living with an animal, and it's probably closer to 70 or 80%, currently living with an animal that is dealing with this. Why? Because they're vet students. They're in class for 8 to 10 hours a day. Some of them have to then go to work to pay for their rent. And then they get home at 7, 8, 9 p.m. and they study for 4 to 6 hours. And they're up until 2 a.m. to sleep for 3 to 4 hours, to then get up and do the whole thing all over again. That's often the reality. Not everybody has different versions of that, but if you're the animal living in a relatively sterile or socially impoverished environment, any attention is better than no attention to some degree. And what we often describe, and we'll talk about this a little bit later in this talk as well, is that the behaviors that are most annoying to the individual are the ones that are most likely going to be reinforced here. So if you have someone who, for example, is very noise sensitive, I would be curious about whether that cat is more likely to develop a vocalization problem because it more reliably gets the reinforcement. I'm very protective of my books, for example. I don't like having the corners chewed. It's the only thing my rag doll ever did wrong. And then now I look back and I'm like, I wonder how much of that would have happened if my influence wouldn't have been there. Because he really wasn't a chewer. But the moment he put teeth on the binding of one of my textbooks or one of my other books, I was right there to redirect. Right? And I find that whether it's giving attention or whether it's redirection in the name of interruption, are we accidentally giving attention to the behavior that came immediately prior to it, and are we inadvertently reinforcing that behavior, perhaps creating a behavior chain, or again, creating other problems? So these are all contributing factors. In other cases, it might be a lack of experience, people who just don't understand cats. And so they're not able to meet basic species needs because they don't know what those are. And if you don't know what you're supposed to do, how could you possibly do it well, right? So I'm looking at this and trying to, oftentimes I'll ask my clients, have you had cats before? If you've had cats, have you had kittens? What's your experience level been? Is this personality, the personality of this kitten, does it look the same or different than those other cats that you've had? Trying to get a sense of where they're starting from. In some cases, we have to reset expectations as a part of our behavior consulting to help them understand that, yeah, even though this cat looks like an adult, it's still very much a teenager. And so those expectations, or maybe those expectations that were set by your previous animal that you got to live with from age 3 until 16, 18, 20, those aren't quite appropriate yet. Maybe we'll get there, but we have to be able to make sure that we're expecting what's appropriate for this particular animal. And then I find that even more so in the cat world compared to the dog world, there's a lot of inappropriate interventions that have been attempted. And we'll talk about interventions as it relates to, let's say, humane hierarchy or LEMA or hierarchy of behavior change. We'll talk about that as we go forward. But that's something that's really prevalent. And I know various speakers this weekend, throughout this conference have already mentioned this. But it's so common for the average pet owner. Sidebar, I just want to be clear, when I'm talking about average pet owners, I'm never saying that or meaning that in any sort of a derogatory way. I'm talking with sort of the client who has the average amount of knowledge. I may at times even call them naive. I don't mean that judgmentally. I mean they're lacking knowledge about something, which is a tremendous opportunity that we have. But if we don't know any better, and our brain goes to those behaviors that are problematic to us, climbing the curtains, biting, yowling, our brain also naturally says, I would like for that to stop. How do you make behavior stop? You stop it. You do that with corrections. Now, again, our brain, as behavior consultants, knows that we can do that in other ways, and we can create differential reinforcement of other behaviors, and we can set antecedent condition. We can do all of that, but the average client doesn't know that. And so it's natural, and I assume that every client that I'm working with is coming at this from the perspective of punishment. I just assume that. And I'll ask them, what have you tried? And I want the list of things they've tried. And I may even specifically ask, even if they haven't brought it up, have you ever tried using a squirt bottle? And even more so than saying yes or no, I might ask the question, what happens when you use the squirt bottle? I'm making the assumption that they've done it. And if they say, I've never tried that. Oh, okay, that's good to know. But if they did, I've already given them an open, safe space to talk about that I'm not going to judge them for that. There's the assumption that it happened. And so it's more of an interviewing technique that allows us to get to some of the dirty stuff, to get that out in front so we can then sort through it and figure out what to do with it. It takes a slightly different approach rather than just getting yes, no questions. But it's incredibly helpful because if I can get to the point where they say, oh yeah, I tried the squirt bottle as the example, and I say, what happened when you used that? Well, they fill in the blank. That might be, as you guys know, it might be the matter that when I grabbed the squirt bottle, I don't even have to squirt him anymore. I just need to pick up the squirt bottle, and now he runs away. Okay, have you tried anything else? What happens next? Is there anything about the way that your cat responds when you pick up the squirt bottle that concerns you? Trying to create a little bit of an inroad that if they don't like the fact that their cat is running away from them, maybe that's an opportunity to create an inroad for a different conversation. If I had a way of sharing additional strategies with you that didn't require your cat to run away from you all the time, would you be open to hearing about them and asking more of a permission statement? So all of these things are relevant, but again, coming back to inappropriate interventions, these are all just contributing factors that may have led us down this path where we're now struggling with the adolescent that's in the room. With all of this background, where do we go? What do we do? For me, what we're going to go through next is sort of all of the nuts and bolts. And there's probably other ones that I didn't think to include because they didn't pop onto my radar, so there's opportunity for discussion. If you think about something that falls into one of these categories and I, for whatever reason, didn't mention it, feel free to contribute that. Both the individuals in the room as well as those on live stream, I'm sure, would benefit from that. So don't hesitate to make this more interactive. I start with normal. Start with normal. What does this look like? Again, we might know all of that information about developmental stages, and we understand that this is something that, starting at approximately this age, we're going to see this uptick in impulsive behaviors and risky behaviors, and despite knowing right or wrong, whatever that happens to mean, the animal is still choosing other response options. That's normal. We know that, but most of our clients do not. And so assuming that what we're seeing in our assessment is normal, and I want to be very clear about this, sometimes it's not. Sometimes what we're seeing is actually more representative of pathology. So I'm not trying to say just normalize all problems. That's not where I'm going with this. Normalize the patterns if they're appropriate for the average adolescent individual. Empathize with frustration. I see this is really challenging for you. Your family member's kind of fed up. They want you to take the kitten back. I can understand how difficult that would be. I'm not trying to problem solve. I'm not trying to fix anything. I'm just saying, yep, I get it. This is tough stuff. The worst may not even be behind us. What do we do next? I find that when we're in that sort of difficult piece, sometimes it can be helpful to identify some of the positive attributes. And whether this is defining it with questions like, I know it's frustrating, and is there anything you really, really like about this cat? Sometimes the same things that are driving people crazy are the same things that they love. I was talking with a vet student when I was teaching in Minnesota last week, and she's like, I don't know what it is, but I keep gravitating towards really hard animals. She's like, right now, and she was describing hard as like intense personalities, active problem solvers, really susceptible to accidental reinforcement issues. And I said, well, you kind of got to figure out how you're going to navigate that because it sounds like you're getting the recurrent pattern over the course of your pet ownership here. So what are we going to do about that? And what she loved about that was in all these different areas where she could look at that as frustration, she's like, I love how independently minded they are. I love how receptive they are to training when I decide what it is that I want them to do. I was like, that is a brilliant way of rephrasing that same frustration, the fact that they are independently minded and they're not listening to what I want them to do. But as soon as we define that and align it, it's exactly the same thing. So we can sometimes turn those words around a little bit and reframe the perspective. I also like letting them know that, again, if we're looking at adolescent behavior that's sort of normal for the species, normal for the age, it gets better. Even if we do nothing, it gets better. At the very least, those behavior patterns and the emotional component stabilizes with maturity. Now, I'm almost never advocating for just doing nothing, because obviously they're still susceptible to learning along the way, and I don't want the rehearsal and the reinforcement and the more ritualization of those patterns to develop. But even if we don't do a lot, if we're talking about normal adolescence, it gets better. And so I want them to understand that they're not looking at a life expectancy of this. But if you're the average pet owner who's never had a cat before, and all of a sudden things start to feel like they're getting away from you, do you have any idea of when it's going to get better? No. So having someone say, I get it, and it's kind of temporary, is a way to create that little bit of a breath, and we know that, and we can share that with them. Something else that I like to be able to identify, and this goes beyond just the adolescent piece, but when we are trying to motivate or provide a framework within which clients can be motivated to create behavior change, and there's a difference. It's not my responsibility to motivate them, but I can help to create the space in which that can happen. What would it mean for you if we accomplished your goals? So whether we're talking about adolescents and they're complaining because the cat is charging around the house all night, I understand sort of what the problem is, but I don't know why it's significant. And I find, and again, taking this beyond feline adolescence for just a second, unless we have at least a hint of what that is, I think it's sometimes really hard to identify with their perception of urgency or truly how motivated they might be to actually invest their time, their energy, their emotions, their finances into a behavior change plan. So what would it mean for you if we accomplished that goal? What I also love about that really relatively simple statement is that if the client says, you know what, quite honestly, I'm not sleeping very well right now because my cat is keeping me awake at night. Why does that matter? Well, I'm really tired right now and I'm not feeling the greatest because I'm sleep deprived. Why does that matter? Keep pushing within professional boundaries. But sometimes you might get a statement where the client says, my husband and I were trying to get pregnant, and I'm worried that the impact of stress and poor sleep patterns is actually affecting my fertility. Number one, that's above my pay grade. But number two, that's meaningful. Because now we're not just talking about someone who's frustrated with their cat, but there's a real world application to this. And then we can bring it right back to say, I get it. I understand. And how motivated are you right now to make some changes? What that allows us to do, even if we don't dive into that, I'm certainly not going to counsel anyone on fertility. That's not what I do. But it gives me a point to come back to later on. Let's say 6 weeks later, 12 weeks later, I feel that their motivation is starting to lag. It gives me an opportunity to circle back around and say, when we met the first time, you told me about something that was really, really important to you. How are we doing on getting back to your goals there? Because if their motivation is lagging, just that little bit of a reminder of why this was important at that point in time is really relevant. They may say, well, that's no longer a concern for us for X, Y, and Z reason, whatever that happened to be, or, gosh, I'd forgotten about that. Some other things came up, it kind of got in the way, but yeah, I'm going to double down. I get it. Let's go for it. And so I don't have to nag. I'm not trying to tell them what to do. It's not me trying to motivate. I'm not trying to light a fire under anybody. I'm just helping them to identify with why this is important for them. And this is as much true of adolescent behavior in cats as it is for almost every other thing that we do. So let's bring this back around to some of the strategies that are focused on this adolescent cat population. Enrichment is everything. And when you think it's not, or you think you've done enough, do just a little bit more, because it is everything. Now, what constitutes enrichment? As far as I'm concerned, that's up to the learner. For some cats and for some adolescents, enrichment might be the opportunity to snuggle up in the hammock all day long. And that's their version of contact time and massage, and that's what really gets that particular individual going. For others, it's the opportunity to have three-dimensional space for exploration and the ability to control their social distance from other individuals, whether that's other cats or whether animals or people in the household. For others, it's a matter of engaging in more active problem solving. And whether it's using puzzle feeders, like the slow feeder type options, or whether it's creating homemade versions of those toys, it's a possibility. It doesn't have to break the bank. So on any budget, it's an opportunity to do this. And so I'll tell my clients, rather than saying, you should get this toy, or here is the toy that we stock, Google it. This is the great time to send them back to Google, right? Not for medical advice per se, but to say, Google cat enrichment. See what pops out to you. You know your cat better than I do. And what I love being able to do is to leverage enrichment that captures the problem behavior in the first place. So if I have a cat who is, where the owner is constantly complaining that the cat keeps climbing the curtains and sitting up on the curtain rod, or they're always on the kitchen counter, or they won't stay off the furniture, guess where we're going with enrichment? Vertical space. What if we created a cat tree or some version of the cat tree next to the kitchen counter? And we made that place even better than your counter. We're creating an opportunity for the cat to engage in something that's meaningful for them in a way that decreases the likelihood of the problematic behavior right from the get-go. So for me, I'm looking at what the problem is as a tip-off for what type of enrichment that particular animal is likely to gravitate toward. And we can narrow the field much, much more quickly. For some, it has to be high arousal chase games, at least to start. For others, you get out the laser pointer and they just look at you like, I get it, there's nothing there. That's a stupid game. Can we cuddle? So what is going to be enriching for that individual? That's where we can really target it. And with any of these interventions, did it make things better? If enrichment, so let's say we're providing puzzle toys or some sort of food dispenser or some sort of foraging option, this is something that's likely going to need to be there on an ongoing basis. And that's something that I file away as the behavior consultant to say, it's working. And so if now 2 weeks later, 4 weeks later, 6 weeks later, the client says, oh my God, it feels like we're backsliding. That's an opportunity for me to say, hey, when we first started, it seemed like your cat really loved X. When was the last time you played that game? And I try to do something like that that's very specific, because if you ask them how often are you playing that game, the common answer is, well, not enough. But how often? Well, I know I should do more. What? Yeah, give me the data, right? So if you're asking it in a way that it's really hard to give you an evasive answer, it makes it a little bit easier to get back to data. So at any rate, enrichment, super, super helpful. Always an option. And I find, and not only is this important for other species, I personally find this to be more important for cats than our other domestic species. And especially if we're talking about indoor-only cats. This is not something that we can overlook at all, and it has to be ongoing. So what this starts to tie into is not only from a proactive enrichment standpoint, but also looking at the reinforcement patterns. So what does that particular learner seem to gravitate toward? If we look at the problems that are happening or the things that are sufficiently annoying to the owner as to create a question around them, what are they focused on? If we're seeing problematic behaviors that happen in advance of meal times, for example, then hunger may play a role in the way that that behavior manifests for that particular animal. If it's always activity or play focused, or whether it's, I find for a lot of the cats, especially those little problem solvers, the ones that tend to be prone towards attention-seeking or accidentally reinforced behaviors, I do really believe that for many of them, that reinforcement of control is powerful. I think there's an enjoyment that comes from being able to have an influence, right? And so when I talk about the reinforcement value of control, I'm not talking about alpha, dominance, hierarchy, or any of that sort of stuff. I'm just talking about the ability to do something and see a ripple effect. And how many of us find enjoyment in that, just like an inherent value, right? It's so common. I think for a lot of our animals, we underestimate the value of control truly as a primary reinforcer. And truthfully, that's something, I had not heard it phrased that way until I was listening to a lecture from Susan Friedman about 1.5 years ago. And she put up her slide with her primary and secondary reinforcers, and she put control up there. She was like, yeah, that's where I want that one. And I was like, what? Susan, you're blowing my mind. I love that woman. So we can play around with the reinforcement patterns. And again, just observing the animal and seeing what they're naturally gravitating towards allows us to then figure out what to do next. We don't just have to throw strategies out and hope that it sticks. We can be observant. We can do better. I'm also aware of, again, back to the attention-seeking piece, what are the behaviors that the owner finds annoying? Now, it's really important for me, I talk to my vet students all the time about this, is that if we're talking about trying to move away from an accidentally reinforced behavior, and if our mind says, well, if they just ignored that behavior, wouldn't things get better? I don't necessarily agree with that, at least in that statement alone. Because what we know about most animals, and I know you've experienced this with probably your own animals as well as the animals that you've had as behavior clients, is that if an animal has an understanding that in their mind there's a contingent relationship between a behavior and a consequence, and then we remove the consequence, the natural tendency is for that extinction burst and the behavior gets stronger. Even if it then starts to dissipate and follows that extinction curve, I think that can be an incredibly frustrating learning curve for the animal to go through on their own. My rule of thumb when I'm working with my clients is more likely to say, what if we taught that animal another way of getting that same attention, food, play, control that they're getting? What if we taught them something else first, and then we can focus, once we're confident that they've learned it, then if we focus on the ignore piece, they already have another behavior that they can just toggle over to, something they've already learned gets the same reinforcement. Does that make it easier for the learner to switch gears? I think that it does. I don't have any data for that, again, but that's what I see in my patients, especially for the impulsive adolescents where they're going for the immediate gratification. I want them to learn how to get that first before I just pull the reinforcers away. And lastly, coaching the process of behavior change. And again, there's so many layers to this, whether we're talking about the way in which the animal learns, whether we're talking about the training tools or the training skills, or talking about reinforcement schedules, or whatever level of complexity we want to get to for this particular client, we have so much knowledge. Something that I'll often tell my clients is that after an initial session in particular, they're going to leave the session with the same animal, generally speaking, that they brought in. And I want them to think about that, because the moment their knowledge changes, there's often an expectation that the behavior of the animal is automatically going to change too. And I want them to walk away knowing, okay, so now I know what I need to do, and now I actually have to do it. So they get just that little hint of what it takes to create behavior change, and they might even use the example for their experience. When you walked in here, you didn't know what to do. Now I've shared that with you. Now it's your turn to pay it forward. Now it's your job to share that with your animal. So we're creating a ripple effect of behavior change, and they can sort of start to empathize with that process a little bit more. And if they start to feel like their learner is getting frustrated, there's probably a frustration component in their experience that we can draw back to as well. So back to creating empathy. Now, in other cases, what we're really trying to look at is teasing apart what the actual pattern happens to be. So this is a cat named Panther. I use this particular video when I'm talking with vet students who have never really done any sort of behavior assessment of any sort prior. And I ask them to describe, what are you seeing? The most common answer I get, especially if I play this before we've done any real significant conversation around behavior, is that I think the cat is playing. And for those of you who were with me in the previous, you saw that coming, right? You saw that focus shift. It's like you knew it was coming. Play, in this case, would be an interpretation. Play can look very different from one animal to the next. So unless we can bring it back to what are we observing? Is this a continuous behavior? What's the duration of the behavior? What's the focus? What's the motor pattern? What are we exactly seeing? Unless we're defining it, it's really difficult not only to make an actual assessment on our own, but it's also really difficult to know whether our interventions are making a difference. And that's ultimately what I want to come back to, is that if we're trying to put some sort of recommendation in place, what are we using as our response measures to say whether it's better, worse, or exactly the same? You know, this is a case where we could look at all sorts of things, you know, the details of saying, well, we're in a home, this is the owner, she has bare feet, sort of a motor pattern that's consistent with play, and we can describe that further. For this particular case, it wasn't until we understood that this is something that reliably happens in the 30 to 45 minutes prior to scheduled meal times, that some more of the motivations, the underlying factors really started to become more relevant. So it's not only about play, there's something else at play here. You know, and rather than getting frustrated, rather than potentially even being injured by a behavior, we have the opportunity to define what we want the solution to look like, and we can put other strategies in place. This is a cat that once we switched him over to more of a foraging meal system, Problems were completely gone. We didn't do anything in terms of active reward or punishment, or we really didn't do anything. We just fed the cat differently and then waited. If we do that, where are we in 3 weeks? If we need to do something more, gosh, let's do it. But this was a busy, professional. She's like, I don't have a lot of time to invest in this. Is there any easy solution? Of course, for her, the easy solution initially was thinking more like, is there a medication? Is there a supplement? Is there some sort of easy fix? It's like, well, yes, you're gonna feed him anyway. So what if we just change the way we did that and then observe what happens? And so what I also like about this particular case is that it reminds me that just because we can do something doesn't mean we should or that we have to. So we could look at that and we could create all kinds of sequences. We could mat train this cat. We could, engage clicker training and enrichment, and we could do all those things. And yet, in order to get to the point where the owners were happy and where this cat was actually living a pretty darn fulfilled life, it wasn't necessary. So just being clear on what we're doing from a behavior consultant standpoint. Now, I want to talk a little bit about punishment because, again, as I said, I go into my consults with the assumption that they've done it. I just assume that that is a part of their process. And so from my standpoint, there's a lot of different ways to approach this conversation, not only avoiding the judgment, but for me, this is something that early in my career, I literally practiced this in front of a mirror. And then what happened? No matter what a client tells me, how horrific or not, and then what happened? It's a neutral response. I'm just looking for the next step in the exchange. And then what happened? Your answer might be different, but for me, I had to develop something because there are certain things that hit hard. And when you know that when clients are ultimately, especially if they're reaching out for help or support, ultimately they want to do the right thing, but in desperation, in frustration, in difficult situations, they're reaching for tools that are accessible to them without full knowledge of what the consequences are. I can't judge that. The moment I judge and I create a wall between myself and the client, I've lost the ability, or at least hindered my ability to create lasting behavior change for the client. And I potentially have negatively impacted the relationship that's there. So I want to make sure that I'm able to see that as more of a partnership and a collaboration and a cooperative effort. And so for me, that's the answer. And then what happens? And we can move forward from that. What I like about that particular question is that what it allows us to troubleshoot, even just kind of coming right back around to that first bullet point, is helping them at a basic level. I'm not going to go into 4-quadrant discussion with almost any of my clients. Probably have 5 in the course of my career that really wanted to go to that level of depth. But what I want them to understand is, what does effective behavior change look like? And for so many clients and sort of the average pet owner, in the moment interruption and a cessation of behavior is defined as success. The cat did the thing, I responded, behavior stopped. And so there's an immediate response pattern of success, which does what to the punisher? It reinforces it. You did this, I did this, the behavior stopped, that was my eventual goal, that reinforces my behavior of punishment. So because they've defined success as stopping in the moment, they're self-perpetuating. So if I can reframe that to them and say, you know what? You know your cat better than I do. Can I tell you a couple of things about how animals learn? So I'm not challenging their views on their cat. I'm not trying to say I know more about your cat than you do. It's not about that. It's about saying, hey, I know a lot about how animals learn. Can I share a couple of details with you? One of the ways that I, as a clinician, as a behavior consultant, measure success is not only whether the behavior stops in the moment, but more importantly, most importantly, whether or not it changes across time. And I'll ask that question. Usually I've already asked that question by the time I get here because I want to already know. And in most cases, what they've been doing in terms of what they're describing as a punishment is at best an interrupter. And once I reframe that and say, it's working, depending on how we define success. But if it's not changing behavior over time, then we're missing the boat a little bit. But it's stopping the behavior because your cat doesn't really like it very much. So again, can I tell you a little about what I know about aversive usage in animals? If we're applying something that the animal finds unpleasant, but it's not creating lasting behavior change, and God forbid we're not even all that consistent, What I know is that that's more likely to create fear, anxiety, avoidance, stress. And based on what you've told me already, I don't think that's your goal here. Are you open to trying something different? Now, that's a very different response pattern from me saying, well, here at the Animal Behavior Clinic, we do not advocate for the use of squirt bottles. I could do that, but now the client feels chastised or shamed. That's not the emotional quality I'm trying to create in my learner, because I need them to carry it forward. So I'm not trying to perpetuate that. So this is all about sort of how we handle that. And obviously, as all of you know, when we are relying more on punishment or interruptions, we're not teaching the desired behavior. And as you also probably know when we're talking with clients, when you ask them that question, what do you want your cat to do instead? How many times do we get met with a blank stare? What do you mean? What do you want him to do? Well, I want him to not jump on the counter. Okay, and what should he do instead? What do you mean? Right? We have to walk them through that process. So by doing that, and when I have clients who are really, really committed to punishment, where their brain just cannot get around that, what I will more likely do is say, you know what? I hear what you're saying. I would like for your cat to stop jumping on the counter too. There's a first step that I want to go through. I want to make sure your cat knows what he's supposed to do. So we'll define that together. When you and I are confident together that your cat knows what he's supposed to do instead of being on the counter, and if he's still making the wrong choice, then how about you and I talk about punishment at that point? And then we can define exactly what that's going to look like. I can almost always get an agreement from the client. And the beautiful thing about that is that the number of times that we actually need to come back and revisit that punishment discussion is almost zero. Because by the time the client actually knows by the time the patient knows what they're supposed to be doing, they just do it. Because we set up the reinforcement contingencies to support that. But what it allows for me to do is to get the buy-in from the client. They understand, yeah, this guy's open for this to be on the table. We can talk about punishment. You're not going to shame me for it. You're not going to wag your finger and tell me what a bad person I am. You understand why my brain is going in this direction, and I'm open to that. And there might be those times where doing some form of quote-unquote correction could be relevant. You know, if I'm working with a dog, for example, are there times where I'm going to tell my dog, try again? Of course there are. But I'm able to do that versus giving a leash correction or reaching for a shock collar because we're having communication about it. And I had to make sure that he knew what was expected first. Same thing applies here. So it's all about that conversation around punishment versus just saying we don't do that. Clients need to have the conversation because this is where their brain starts. And if I want them to do something different, I have to start where they are. And this is a huge example of that. As we start, as we come back to the big picture here with our adolescent cats and struggling with some of the challenges that our clients are facing, not only are we talking about enrichment, but just generally speaking, basic needs. For me, that goes beyond enrichment. If I'm counseling them to say we can avoid the situations under which those problematic behaviors are happening, we're taking that avoidance pattern, what are we doing instead? How are we capturing that motivation? How are we preventing the rehearsal of unwanted behaviors? And how are we not only just filling in the vacuum, but how are we being preemptive in the situations in which those problems are more likely to occur? How can we be strategic? So a good example of this about being more proactive might be to say, well, if we were being just general about enrichment, I might provide foraging opportunities for a cat. And I might do that consistently for, let's say, 3 weeks. To see what impact that has on the other behaviors that we're looking at. And maybe that helped, but it wasn't quite good enough. And I still have a cat who in the middle of the night is getting the owner up. So is that the time then to narrow down our enrichment to something much more targeted? Is this a matter of doing only just a little bit of enrichment throughout the day? So I'm setting up that animal to really want to do something, and then the last thing we do before bed is we stash our foraging items around the house. I'm sort of being more strategic in the way that I'm advising. So it's not just enrichment, it's about actually having a therapeutic intervention. So there's all sorts of variants that we can apply, but thinking creatively about that is really helpful. Now again, some of these things are strategies that you know as well as I do. I just want to call them out in a couple of different ways because I think these are things that we can help our clients to understand, especially when they're struggling. I am not, generally speaking, a huge advocate of creating any restrictions on my learners. There are times where I might limit that a little bit, kind of like I was just describing about giving a little bit less reinforcement throughout the day so I can leverage that overnight. But I don't typically like creating a sense of deprivation in any way in order to then set them up to want to do more at other times. And in most cases, we don't have to. My clients, looking at the second bullet point here, my clients often need a lot of help, and I'm guessing that yours do too. Even as we say, oh, here's what you do and here's how you do it, especially if these are cat owners who have never trained an animal in their life, they need a lot of help in understanding sort of when and how and what to do. You know, the idea of, auditioning reinforcers or creating a reinforcement hierarchy based on different values isn't a concept that most cat owners have sort of right at the tip of their fingers. So we have to be able to coach this and provide them with the education to the degree that they need to be successful. And that's also an important sidebar within this, that we're not trying to meet my goals as the behavior consultants. I'm trying to give them enough tools that they can reach their goals. What I also have to remember, and this comes back to how we define success across the big picture, but especially here, is that even if we set our initial bar here, the client says, I want my cat to sleep through the night, as an example. And we put our behavior change plan in place, and I ask the question, is your cat sleeping through the night? Well, not really. If my brain says, well, then we're not done yet. Now keep going, keep going, keep going. If I give the client space to say, well, they're not sleeping through the night, but somehow I am, and ultimately that was the real goal in the first place, then maybe I don't care so much that my cat is getting up a couple of times in the night. So maybe the goals change. And I find that for a lot of our clients, the goal that they set at the beginning is real for them. But as we start to get progress in some way, the urgency, the motivation starts to wane. And I think Michael Boss said it earlier today. He was quoting someone else saying, don't let perfect get in the way of good enough, which I thought was just a perfect quote for things like this. We may not have met those goals that we originally defined, but as the behavior consultants, we have the freedom to say, does that matter anymore? Are we good enough? Have we met the goals that meet your needs right here and right now? And have I coached you in the skill set needed to be able to do that? I also find that for a lot of my clients, both on the feline as well as the canine side, that this distinction matters. So many of us want to be able to kind of train kind of on the fly, like as life happens. And as we know, when we're learning something new, it's so much easier to learn that skill without distractions in a very discrete context, and then we can learn how to apply that skill across a wide variety of circumstances. But if our clients don't know that, that's something that we have to address as part of our behavior change plan. And if the client's really struggling with this, how much time do they have to set aside? Depends, right? So I would rather go into a behavior change plan asking the client what is doable. Is 5 minutes twice a day doable for you? Do you believe that you commit to that with at least a 90% consistency? What I can't tell them is whether that's enough. But if it's doable, I get the opportunity to decide whether it's enough based on the way the behavior of the animal changes. If I'm only saying, well, I think you need to do at least 30 minutes twice a day, and the client says, oh my God, I can't do that, but I'll try. And now they come back in for a reassessment, and I find that they've only done it a handful of times since the first appointment. I actually don't know what was possible because we didn't do anything consistently. I would rather commit to what's doable and then decide whether it's enough than setting some arbitrary goal that I think it's enough but may not be doable. Does that distinction make sense? Yep. That for me is a really important detail when we're creating behavior change plans. And ultimately, we're looking at these other factors as well. What are the other tools that we may leverage that can we pull into the big picture here? What's the end goal? What I want to move on to as we move away from some of these strategies is what are some of the different things that we can do? Now, some of these video examples are not adolescents, but I want to think about how these could be useful for some of those problematic behaviors that we were defining as more adolescent problems. So this is a cat. This is actually an adult cat. You'll see that in its movement patterns. But this is a cat, when the owner is in the kitchen, the cat is constantly either on the counter or underfoot. The problem with this cat being underfoot is that it's a trip hazard. It's not aggressive in that context, but it's a problem. So with leveraging just a couple of little skills.
And jump up again. Up. Good.
By teaching him targeting, creating an elevated station. So at the very least, if he jumped down, and he's got a belled collar on as well, so even she's a little bit hard of hearing, but even if she's cooking at the counter and she's stationed him and we worked up duration and we did all of those things appropriately, or as appropriately as we needed to, put it that way. If he jumped down to the floor and was now a trip hazard, she could hear him. So there was an awareness of what was happening around her that allowed this to be successful. So now when she's cooking, she's got her tools at the ready, and there's a little, his dinner is basically next to her on the counter, and he's going to get that intermittently when he's on his perch or his pedestal. So if we're utilizing a tool, something like that with stationing, whether that's more of a version of mat work, whether that's something like this, using a pedestal or an elevated position. I love doing this for cats who might be tempted to dash out the doors, like the adolescents in the exploring. So it's creating an elevated station near the door. In my experience, the higher the station, the better. So if anything, I want it up there. Like I want that cat so far up there that we have the ability to do this. There's a lot of applications for something like this. In other cases, now this is a video example that we were using as a way to reinforce disengagement. This is an intercat aggression case. There's a couple of, I'm going to say, inaccurate and missed opportunities early on in the clip. I'm just going to let this play out. So we've got one cat on the inside behind a screen door, so we've created a physical barrier. There's another cat out to the left side of the camera. So trying to get the timing, so when the cat orients, essentially teaching an uncued look at that, essentially. So when the cat orients to and attends to the other cat, and then turns back in the direction of the handler, in this case, there's a click and a treat. So we're likely getting some degree of classical conditioning, but more importantly, trying to capture that active disengagement. Missed opportunity. Like, dang it!
That's stupid.
Better.
Nice.
It's me behind the camera. Yeah, nicely done. So this is a reminder for me. So again, I'm going to bring this back to the adolescents, for example.
Nice.
This is a click and treat for disengagement is sort of the shorthand version of this. The first case that I ever did this with years ago was a little blind adolescent cat named Stevie Joe Leo. I will never forget that cat. And he was one of those active problem solvers. Blindness was not holding him back in the slightest. But the problem for Stevie Joe Leo is that he was actively targeting one of the other cats in the household. And if she moved in any way, he was orienting to her. And it was basically body language would suggest that this was sort of a game for him. He seemed to be having a grand old time, but the geriatric target of his affections was not. So we set up a contingency. So we did just a couple of days. He actually took to a harness and a leash very, very quickly. And then we set up a scenario like this, where anytime that he oriented in the direction of other cat, but then actively disengaged, he got the click and the treat, which was way more reinforcing for him than chasing the cat ever was. So we went literally from the assessment to the point of having him acclimated to harness and leash, understanding a secondary reinforcer, and being allowed to roam freely with the leash off was under 3 weeks. For an owner who had never done this before. Now, I wouldn't say that happens in every case by any stretch of the imagination, but again, it's possible, right? So I like thinking about this if we have an animal who's really fixated on something, and especially if it's a cat who maybe in that adolescent phase has been accidentally reinforced for a particular behavior. Not only can we strengthen other behaviors, but doing some sort of captured reinforcement for disengagement might be an extra skill set that creates a different motor pattern for that learner. In other cases, we're thinking about ways of leveraging reinforcement. And I put this one in there again as another example of ways to think about problems that may show up. This is a cat that was presented for inappropriate elimination while still in the adolescent phase. So I put this in there both as a reminder that problems can show up at any age, but also for really active learners, clients often need a lot of coaching.
Yep, he knows. He knows. That's how it goes. You wanna go pee? Go ahead. You can go pee.
Again, some stuff here is really good. Others, we've got some lost opportunities. You'll see the difference.
Got a freebie.
No, we're just...
You're gonna have to be quiet though while he's doing it.
I love when you get bickering on camera as well. Tells you a lot about the social dynamic. Does Boomer understand the contingency between foot on lip of the larger tray and the click treat? I think so. Does he seem to be moving beyond that? No, they're kind of stuck there, aren't they? Clients need coaching. I kept telling them, send me a video, send me a video, send me a video. They had been doing this for weeks.
Trick-or-treating just gets him to the edge then. It doesn't get him in.
Well, because I can't put the treats in the litter.
What happens if you put it on the edge of the litter box?
Then it gets in the litter like it's doing right now. That's why I always have to sweep before we start. Did you
Well,
lose
this
it?
is one for
I know.
Chris, is how you do
That's-
this. Oh,
that's-
there he
okay,
goes.
go ahead,
And then he
please.
finally enters the litter box, and they bicker through the entire thing.
Okay, so...
I was like, no, come on, come on. So I put this in there. Again, this is slightly different in terms of our focus, but when we're utilizing our tools that are available, again, clients need help. Had we talked about raising our criteria? Like 7 times. But they got really good about this, and they could not figure out, but how would I put the food into the box? I said, well, you never had to. Could we do this differently where every time that he puts that paw up, we click and then toss the food behind him, so we have to create a little bit of that momentum where he has to come back and we're getting both the approach as well as the touch. And then if he's getting that and we're not so focused on putting the reinforcer right where he is that keeps him grounded in that sit, could we then wait for him to take that additional step? Absolutely, and that's what we did next. And within about 2 weeks, he was reliably entering the box for the purpose of elimination. Ironically, Boomer was a cat who the urine piece was less of a problem for him. He had a conditioned aversion to the box for defecation because of some underlying medical stuff that happened during adolescence. So it is still relevant for this particular talk. Ironically, from a learner perspective, what Boomer learned was that if he was home alone, we had worked enough through that conditioned aversion that he would utilize the box on his own for defecation. If the owners were present, he would go find them and yell at them or knock things off tables until they followed him to his box to be able to do the click or treat for poop thing. Whether that was 2 in the morning, 6 in the morning, and I was like, well, would you like to, again, difference in criteria, right? I was like, well, we don't have to stop there. We could teach him to poop on his own because he's clearly capable of it, and you don't have to get up every night at 2 in the morning. She was like, well, I usually get up around that time anyway. It's fine. You know what? If it works for you, I'm a happy camper. Success. Probably not where I would have left off, but that's where they left off. So other examples. So I put this one in here. This is a little cat named Nils. This is a cat that I put in here because I want us to never lose sight of sort of what's happening in the adolescent brain. I love those little fingers. It's right there. Timing is way off. What were we doing with this cat? Nils, this was the initial stage of target training and teaching him to approach and make physical contact with a target. For those of you who have not done a lot of clicker training with cats, it takes an entirely different level of patience than if you're used to doing this with, let's say, border collies. The distraction factor, if he eats more than about 8 treats in a session, he will reliably vomit, regardless of what the treats are. So you have to cap them at a certain point. So you only get, maybe it's more than 1 per year in terms of our approximations, but we still have to be relatively careful with that. The reason why we are working through this, so now that target, once we've got a more of a reliable approximation to that, what we were trying to work on for Nils was a direct effect of single traumatic learning. One trial learning where he was put in the carrier for his adolescent physical exam. And if I remember the details correctly, at some point in the process, I think the owner may have actually dropped the carrier. And it was like, not very far, she's a short woman. But there was a traumatic experience in the context of the carrier. Nils freaked out, for lack of a better term. I didn't see it, so I can't describe it in better terms. The ultimate goal was entering the carrier. This is a great example. She was so fixated on working the target that she forgot to reinforce the behavior that we were originally using the target to get to, which was carrier entry. He was so aversive to the carrier that we had to break the entire process down. And so I put this in here as that reminder. Again, lots of stuff. Totally missed the golden opportunity to launch our training forward. Of course, it's not in real time. So I watched the video later. I was like, no. But I put this in there as the reminder that if we go back to that graph that I showed you on the right-hand side of the screen, that learning phase that develops over time in relation to that activity within that prefrontal cortex, that the impact of trauma through the adolescent period is especially impactful. That one event changed Nils' life. We are now at the point, this is literally almost 2 years later, he can now be in the carrier, he can be confined in the carrier. We've gotten him to the point where he can be in the carrier with it positioned on like a wobble board type thing, so as he moves around, the carrier moves. Very difficult to move to the next phase of actually being carried. Getting there, but not easy. So I put this in there again as that reminder. What I also want to stress is I'm thinking about these things, above and beyond just the adolescent piece and above and beyond the mechanics of secondary reinforcers and all of that sort of stuff, is my perspective also allows us to talk about this stuff. And as behavior consultants, this isn't necessarily in your wheelhouse, but it's an option, right? If we are working an animal through a protocol of behavior change and they're not progressing, whether we're talking about an adolescent or whether we're talking about an animal of another age range, these are some of the relevant things to consider. And so when I'm working with my vet students, my veterinary colleagues, I'm essentially working through these 3 questions. Are we treating something or someone that has the potential to respond? So are we treating a behavior that's motivated by fear, anxiety, stress, arousal, compulsive tendencies, something along those lines where we've got some documented evidence that a quote-unquote medication could be helpful? For me, medication is anything that might be truly pharmaceuticals. It might be food or nutrition. It might be nutraceuticals or supplements. It might be pheromones. It might be all of these things kind of fall under the medication, quote-unquote, header. So what are we treating? What's the relevant time frame, more of a situational versus a maintenance treatment? And then before we make an actual selection, what are we truly at a physiologic level trying to impact with our decision? And that's what leads me to the actual choice of what to recommend. And so what I'm looking at, especially if we bring this back around to the adolescents, obviously I'm not standing here saying every adolescent cat should be medicated, although some days it might kind of feel like that. What I'm saying is that if we are doing the other stuff and we're struggling, especially in a case like Nils, for example, where there's an impact of fear, anxiety, stress, or something along those lines, are there options that we can reach for, even perhaps some of the over-the-counter options, to try to facilitate that? And that's a much bigger discussion, obviously, but I didn't want to walk away from this particular topic without saying that in every single case, this is on my radar. When I'm looking at what I consider to be a three-pronged approach to behavior change, and this is not necessarily talking about the behavior change hierarchy, but really thinking about every case, I have to consider what are the behavior mod steps, i.e. what is the emotional state or the behavioral shift that I'm trying to achieve. Secondarily, what is the management plan that keeps the animal out of those circumstances, either because of safety or rehearsal reasons? So what are we doing until that emotional or behavioral change has occurred? And then does that animal need additional help in order to accomplish that emotional or behavioral shift? And that's where the medication piece comes in. So the first two pieces, by all means, that's all about you guys. And if you're struggling that because of that fear, anxiety, stress, arousal, or some other emotional component, the animal's not capable or is not progressing the way that we think that they might otherwise be capable of, then that's a great time to re-engage that conversation with whoever the attending veterinarian is for the adolescents as well as for any other animal that's in your care, so that we can move them forward. With that being said, we've covered a wide variety of details specific to adolescence, but also kind of branching off in a couple of other directions because of how common some of those adolescent patterns are and how we're likely to see them across other patterns as well. Does anybody have any questions for me before we wrap up for the night? Yes?
I was wondering if you've seen a breakdown in relationships in multi-cat households when a kitten becomes a teenager.
Great question. So have I seen a breakdown in relationships in sort of the adolescent phase in a multi-cat household? Absolutely. For two primary, potentially multiple reasons, but in two, I would say, more likely ways. One would be a case like Stevie Joe Leo, where they're just an adolescent and they're understimulated, and so that behavior is sort of being kind of in an antagonistic way being directed towards a housemate, and that's not exactly appreciated, and that creates a breakdown in the relationship. In other cases, if we have an environment that is insufficiently supporting the number of cats that are present, and if you look at the actual ethology of the domestic feline species, what we understand is that the number of cats that a given environment can support is directly related to the density of resources available within said environment. And what most cats would do if they were living in a world without walls, if that conflict exists and the environment is not supporting, someone leaves. Dispersal is more likely than is conflict resolution. And so in the absence of great conflict resolution skills, and in the absence of the ability to disperse, we get fighting. In my experience, it's often when we see it happening for those reasons, it's a little bit later in the adolescent process, more so in the age of, let's say, 2 to 5, more sort of on the tail end as we're approaching actually more the early side of social maturity, where we start to see the relevance of resource availability or resource density really factoring in. But the answer is absolutely. And especially if I'm seeing it in that 2 to 5 year age range, my first question is we immediately evaluate the density of resources: food, water, resting locations, litter boxes. And then we take it from there. So absolutely. One more question and then we're gonna break. Yes?
What are your thoughts on exercise wheels for indoor cats?
What are my thoughts on exercise wheels for indoor cats? I think it depends on the cat. I think some cats naturally take to them better than others. What I'm also looking at is to find out if this cat is well exercised, does that have a significant impact on the other behaviors that we are trying to change? One of my canine patients, for example, comes to mind when I think about this. He was a boxer pit type mix. The owners had rigged up their treadmill that the dog could turn it on at will. And they came in one day and he was up to 26 miles. He was ripped. I mean, he was just, and it had zero impact on his overall behavior. So I have to look at, not only is it an option, some more than others, does it have an impact? If it has an impact, what I also then start to worry is we do see cats that develop perhaps more of a ritualist or stereotypic or bordering on compulsive pattern associated with that monotony of the wheel. I get a little bit concerned about that. For the cats who sort of jump on, sprint a little, and then hop back off again, fine. But I don't make a blanket recommendation, yes or no. Thank you guys so much for your attention tonight. Appreciate it very much.